Hey there, I'm Dr. Jim, and I have a serious topic today. It's self-injury, a brief introduction. And I became interested in self-injury many years ago, 15 or more years ago. As a gerontologist, I thought to myself, I wonder if seniors hurt themselves, and they do. It's not just younger people, teenagers, adolescents, some middle-aged individuals. This affects everybody of any age. So self-injury is the deliberate injury or alteration of one's body tissues without the intent of committing suicide. Most times these acts are performed to relieve distressing thoughts or emotions or sensations of reality, and sometimes numbness. According to the Mayo Clinic, which I respect a lot, self-injury is often performed impulsively and is at times referred to as an impulsive disorder. There are several other names for this condition found throughout the scientific and academic literature, including self-harm, self-injurious behavior, self-mutilation, self-abuse, self-inflicted violence, and non-suicidal self-injury, which is also called parasuicide. Harm to the skin, cutting. When we talk about self-injury, many times we're talking about people who cut themselves. The type of self-harm that one engages in depends on many factors, including their personality, their emotional and mental state, and their history of psychiatric or psychological illnesses. Some individuals might begin by cutting themselves by just lightly scratching the surface of their skin, and then progressively get worse and cut deeper and deeper in order to actually draw blood. Others may brand themselves with items that they can actually heat up and then apply to their skin. There is a concept called embedding, and as I used to lecture on self-harm to healthcare providers and professionals and hospitals and other places like that, they couldn't actually believe that embedding, some could not believe that embedding was a thing. Other individuals have experimented with embedding objects, which means cutting your skin open. Let me raise my hand there. You cut your skin open and you push an object like a wedding ring under your skin, and then you sew yourself up. It's embedded in different parts of your body. Rings, metal objects. This is a very controversial form of self-injury because some people view it as a culturally accepted form of self-expression and not necessarily self-harm. Still others will burn themselves using various objects and causing friction to the skin. Now, skin picking. This is can be another form of self-injury. Dermatillomania is the technical term. Dermatillomania. Some people engage in a behavior known as skin picking, which is also known as dermatillomania or excoriation disorder. This too is controversial because it might be less about self-harm and more about obsessive compulsive disorders. So interfering with wound healing may be another form of either self-harm or dermatillomania. Depends on the individual. Extreme body piercing and tattooing. There's a fine balance here too. Another form of self-harm that may or may not be associated with any psychiatric illness whatsoever, but rather a culturally acceptable form of self-expression is extreme piercing or tattooing, which has existed in one way or another throughout world history, right? What about self-abuse and poisoning? Some people do that. Other forms of self-injury include hair pulling, bone breaking, hitting, punching oneself, and headbanging. Other individuals may try to harm themselves by consuming harmful chemicals, poisoning themselves, and overdosing on drugs or other substances. Now, here are some risk factors for developing self-injury. The age that these types of behaviors begin to occur is between the adolescent years and the teenage years. It has been shown in research that various forms of emotional and mental illnesses may be associated with harming oneself, especially disorders like depression, phobias, conduct disorders, impulsive disorders, and substance abuse. Some experts say that poor coping skills and emotionally invalidating environments may be associated with self-injury. In other words, people don't feel as children that they're being loved by their parents or others. Other people point out that childhood abuse might be a risk, as well as troubled parental relationships, lack of support systems, and a family history of either self-harm or suicide. In some cases, autism, bereavement, poverty, and unemployment may be associated with self-injury. Now here's some information on demographics and statistics. Accurate statistics of people who engage in self-harmful behaviors are very difficult, as you would imagine, very difficult to obtain, because until an individual actually seeks treatment, they're going to be left out of the count. Rates of self-harm appear to be much higher among younger people, with an average age of onset being around 12, and the earliest reported cases being between 5 to 7 years of age. That's really young. In some surveys, up to 10% of young people admit that they do intentionally hurt themselves in some way, including headbanging, scratching, and hitting oneself. Between 1 to 4% of the American population engage in some form of superficial self-harm. Individuals diagnosed with intellectual and developmental disabilities have a much higher rate of self-harm, anywhere between 15 to 20%. Here's some final thoughts. Self-injury is a serious emotional problem that starts earlier in life and then progressively worsens as the individual ages. While many causes and risk factors are associated with the behavior, it is still unclear if it's due to co-occurring illnesses like OCD, depression, or substance abuse. It's a very murky topic. More research is greatly needed, obviously, to determine perhaps if self-harm is genetic. Does it run in families? Is it learned socially? Or in many cases, is it simply just an act of extreme self-expression? Lots of questions on this topic. Self-injury, a brief introduction. I'm Dr. Jim Collins. Thank you for spending time with me. Keep coming back. Email me if you have an interesting topic that you would like me to research, or I may already have tons and tons of information on it and you'd like to see an article or a video. My email address is jim@collinslearning.com. Send me your thoughts. I'll see you soon.